Have you ever walked into a renewal blind thinking everything was fine, only to get hit with double-digit increases that you never saw coming? What if I told you that 8 out of 10 CFOs don't actually know the real drivers of their company's health spend until it's too late? Today I'm giving you an annual review checklist that doesn't suck. It's the same framework that smart employers are using to catch overspend, tighten up risk, and stop handing money to vendors who thrive on your blind spots. Guys, by the end of this video, you'll know exactly what to check, what to question, and what to fix, so that you can take control of your renewal instead of being controlled by it. The first box on your checklist should be medical claims. Don't just glance at totals, dig deeper. Compare year-to-date claims against the last several years. Look at the trajectory. Is your spend trending above the medical consumer price index? Are a handful of high-cost claimants driving most of your increases? Likely. Here's the rule. If 5% of your members are driving 50% of your spend, you need to know exactly who, what, and why before your renewal hits. Then there's your pharmacy spend. Pharmacy is the fastest growing line item on your plan, and specialty drugs are the main culprit. We're talking about treatments that can run $80,000 to $150,000 a year each. You need a list of your top 25 medications by cost and volume. If you don't have this, you're flying blind. And if you do have it, the next question should be, are these meds being sourced at the lowest net cost? Or are you letting a PBM rebate game make you feel good while you still overpay in the first place? Because here's the kicker, guys. A single drug like Bimzelx, Skyrizi, or Humira can change your renewal outlook overnight. If you're not monitoring this mid-year or pre-renewal, you're setting yourself up to take whatever number gets handed to you. You should know what could blindside you at renewal and what tools you have to prevent it. Stop loss coverage is the protection piece. It's your backstop against catastrophic claims. But don't just assume it's doing its job. Look for claims that are creeping up on your deductible or your attachment point. Ask if any members are likely to be lasered next renewal. If you don't check mid-year, you're giving underwriters free rein to jack your rates without warning. Now let's talk a little bit about risk mitigation. Too many employers think that the only lever to pull is tweaking deductibles or copays. But the real savings comes from strategies that lower your claims exposure. Money in equals money out. So if you can pay less for the cost of care, ultimately you're going to be able to drive down your premiums. And this can happen before your stop loss even becomes an issue. Direct contracts can cut out the PPO middleman and help you negotiate fair rates directly with hospitals and physician groups. Or maybe independent PBMs. Moving away from the rebate-driven pricing games, independent PBMs focus on lowest net cost, at least the right ones do, not spread revenue. Then there's PAP and MAP programs. Patients assistance programs or manufacturers assistance programs can offset tens of thousands per specialty drug spend. If you're not screening for eligibility, you're likely burning cash. And also international sourcing can be very beneficial. High-cost drugs sourced through legal international channels can run about 40 to 60% less than the American counterpart. It's not for every situation, but when it fits, it's a game changer. Risk isn't just about protecting the worst case scenario. It's about proactively shrinking the size of the risk itself. The best employers don't wait for the claim. They engineer it out of the box. Now, let's tackle the silent budget killer, admin fees. Most CFOs obsess over claims but never question admin charges. Yet TPAs, PBMs, and networks slip in fees that can quietly eat up 6 figures a year. Things like network access or claims repricing or per member admin costs that are 20 to 30% higher than the industry norms. Here's the issue. These fees often have zero tied to performance. You're paying whether or not they deliver value. This is where alignment comes in. If your TPA makes more money the more claims you run, you've got a problem. If your PBM's profiting off rebates while your drug spend explodes, you've got a problem. And if your broker's collecting bonuses from carriers while telling you that they're vendor neutral, you've definitely got a problem. The fix? It's simple. Align your incentives with your vendor partners. Flat fees instead of commissions. Transparent pass-through pricing instead of spread margins. And contracts that make your vendors profitable only when your plan is performing well. Because here's the truth. Misaligned incentives are the reason that health insurance costs keep rising. This annual review is your chance to audit not just the numbers, but the motives behind them. Next, let's talk network utilization and plan design. A network only works if it's being used effectively. Run the numbers. What percentage of your spend was actually in network? If it's not in the 90 to 95% range, or just say 90% or higher, then you're bleeding money. And when you see repeat out-of-network offenders, that's not just noise. It's an opportunity to solve the gap with possibly a direct contract or maybe a tailored network solution or navigation support. Plan design is where you can create incentives that maximize your plan's performance. Your deductible, co-pays, and co-insurance aren't just cost-sharing tools. They're literally the incentive structure of your plan. The question is, are they driving the right behaviors? This is where your strategy comes in. Maybe you think about implementing tiered networks, lower member costs for using high-value providers, higher costs for low-value ones, or care navigation, guiding your employees to the best providers, bundled surgeries, or centers of excellence, and rewarding them for following that path. Smart incentives look like structuring benefits so that employees choose quality and value because it's easier and cheaper for them to do so. Here's a real-world example. We had an employer that waived the deductible entirely if the members chose a center of excellence for joint replacements. This resulted in world-class care, and the plan saved on average about $40,000 per surgery. A plan design that shifts cost is just lazy. A plan design that actively steers people towards better outcomes and lowers spend, that's what wins. Your vendors are supposed to be partners, but too often they're acting more like silent shareholders, profiting whether you win or lose. That's why the annual review isn't just about looking at what you're paying. It's about holding your vendors accountable for both service quality and financial performance. You need to ask the tough questions. Did your TPA actually process claims cleanly, or are errors costing you time and money? Did your PBM deliver true lowest net cost savings, or just big fat rebate checks that make you feel good while your drug spend climbs? Did your stop loss carrier pay claims without hassle, or did they stall, audit, and delay to protect their bottom line and boost their earnings? Did your broker provide you with an actual strategy to overcome your current cost challenges, or did they just show up with a renewal spreadsheet? Here's the kicker. Every one of these vendors, they work for you. If they're not aligned with your goals, you're essentially paying for their growth, not your savings. We recently audited a client's RX claims and found that the guaranteed rebates, while they looked great on paper, but the hidden spread added $20 per script on generics. Multiply that across thousands of prescriptions, and you can see how misaligned incentives will bleed your plan dry. The annual review isn't just about numbers on a spreadsheet. It's about how the plan is actually experienced by the people using it. This is why you should also consider using employee feedback. Not after your renewal, not at open enrollment, but now while you still have time to act on it. You can pull feedback from multiple places. Employee surveys, maybe complaints to HR, or questions that come up during open enrollment. Then look for themes. Are employees struggling to access primary care? Are prescriptions creating affordability issues? Do they understand how to navigate the plan? Or are they confused about where to go for care? Here's the catch. Leadership often assumes one thing, and the employee reality might be completely different. We've seen employers swear that everyone loves the plan, until a survey revealed that 40% of staff were skipping prescriptions because of cost. That disconnect is what fuels turnover, dissatisfaction, and higher claims down the road. The annual review is your chance to identify these pain points early and bake solutions into your strategy before your plan blows up at renewal. Here's where most companies end up stumbling. They start the renewal prep only after the carrier drops the renewal on the table. By then, it's too late. You're left reacting. Your annual review checklist should leave you with a clear timeline for renewal prep. You can start now by compiling your renewal materials early. Pull your claims reports, your vendor contracts, your stop loss data, and your benchmarking before you're under pressure for the deadline. Also set some goals. Decide up front. Are you trying to lower your cost, fix or variable, improve your benefits, or maybe fix your vendor misalignment? Without goals, your renewal is just an exercise in accepting what's handed to you. Next, you want to align your leadership. CFO, HR, and executives need to be on the same page months before renewal. What's the problem and how are you going to solve it? Too often, HR wants affordability, finance wants cost control, and leadership wants retention, but no one's connecting the dots. The bottom line, renewal prep isn't a one-time event. It's a year-round discipline. The employers who win are the ones who walk into the renewal with their own playbook and their own plan, not just the one that their broker or carrier hands them. Annual reviews don't have to be a fire drill, and they don't have to suck. With the right framework, you can walk into your renewal with confidence, feeling prepared. Skip this, and you're stuck reacting to your carrier's increases, your vendor excuses, and costs that you can't control. I've put all of this into a simple annual review checklist that you can use with your team. DM me annual review on YouTube or LinkedIn, and I'll send it to you. And if you want expert eyes on your plan, we'll walk through it together. I'm Rich with Benesmart. We help mid-size employers stop the overspend, align incentives, and build health plans that actually work for both your business and your people.